So we'll be talking a lot about World Cup, etc., some other sports news, other news that we've been talking about. But right now, we've been keeping an eye on a picketing and now a rally of hospice nurses outside Abbott Northwestern Hospital. They are staging a one-day strike today, and they are now speaking. So we'll listen in.
That was back in January. We have been negotiating since that time in good faith, trying to get the fair treatment and compensation that these hospice nurses deserve. And they took a hard decision, a hard vote, and they voted 96% to authorize today's one-day strike. You see almost every member of this bargaining unit standing behind me today. That's a sign of the unity of this group, and it's also a sign of the strength of the leadership of the bargaining team. And I want to introduce one of the leaders, one of the members of that union bargaining team now, Susie Smers, who's been instrumental in organizing the union, in bargaining the first contract, and having the hard conversations that it took to be out here on this one-day unfair labor practices strike. So let's hear it for Susie.
That's not emotional for me at all. My name is Susie. Give me a minute. Sorry. This is not something I've ever done before. I'm a hospice nurse. I love my job. We love our jobs, right? We love caring for people in their hardest days. We love showing up for their families to teach them how to take care of them, how to ensure that they die comfortably, that they die peacefully and with dignity in the way that they want to die, but that they even live until they're dying, right? Like, that's what we do, right? And at Allina Hospice, we're not able to care for our patients in the way that they deserve. We don't have adequate staffing. We're asked time and again to step in to cover other people's shifts, nights, evenings, weekends, and get not any even overtime for that, right? We can work 20 straight hours and get our hourly pay. We don't have holiday pay. What nurse in this entire country doesn't get holiday pay, right? I just worked 4th of July. It was a long, hard day, right, Amber?
Yep.
Yeah, and those who worked it. And you know what? We're not going to stop showing up for our patients. We're not going to give less care. But we deserve to also have a work-life balance. That's a really big piece of this, is we want to be able to take care of our families, to take care of ourselves while we take care of our patients as well. And you can read the signs. We got together to design the picket signs. They are symbolic, very clearly, of what we stand for. And to be honest, we are absolutely worth being valued. We are worth being listened to, and have Allina come to the table to work with us. We will work with them, but we deserve a fair contract that allows us to keep doing this job for the long haul, because we want to do it for the long haul. That's how much we love it. So that's, I don't know if there's anything else I need to say, but that's it.
Thank you, Susie. Thank you to Susie and all of the members of the bargaining team. If you're a member of the bargaining team, will you raise your hand and be recognized? It is an awesome privilege getting to work with these women, these caregivers who just are asking, as Susie said, for a fair contract from this employer, Allina Health, which, by the way, is in the process of being acquired right now by a California-based health system called Sutter. So we have a lot of concerns as a union about that acquisition and whether it's really in the public interest of the people of Minnesota. We're working together with a coalition of other unions and community groups to seek direct conversations with Sutter Health and Allina Health about what sort of commitments and investments they're going to make in Minnesota patients and communities and workers. if they want to have this acquisition proceed. We have one other speaker today, and then we'll see if there's any questions from the press. And that speaker is a longtime friend of our union. His mother was a steward in our union for many years before she retired, and he's now our endorsed candidate in the 2nd Congressional District for U.S. Congress. So let's give it up for Matt Little.
Hey folks, my name is Matt Little. I'm here today because my mom was a union steward for SEIU for 15 years. And when my mom got sick a couple decades ago, SEIU had my mom's back. So it's an honor and privilege to be here and have your back. You know, I can't imagine anybody here got into hospice work for the pay. Raise your hand if there's a millionaire behind me. I don't see any. You didn't get into this work for the pay or the glory. You got into this work because you have a tremendous capacity for compassion. And you have the skills. Sure, it's a skill to check vital signs. Sure, it's a skill to draw blood. Sure, it's a skill to change someone's diaper. But you have other skills that can't be taught. Having empathy is a skill. Holding someone's hand that is deeply afraid is a skill. And being someone's friend when they don't have any visitors is also a skill. And by God, those skills are worth paying for. Now, in my day job, I sue insurance companies for a living. And that's partly because they treated my mom poorly. So I know how this goes. The people on the other side of the table, they always want to negotiate. They always want to negotiate, and they never want to settle. They never actually want to come to agreement. And so they'll keep coming up with excuses. You know, before it's you don't have any money. Now it'll be because of the merger. If the merger doesn't go through, it'll be some other excuse. That's how it always goes. So I just want to send a message to the people on the other side of that table. If we are privileged enough, we get to grow old. It's not a privilege everybody gets. But if you get there, you will also grow old. And you will eventually need help. You will eventually need hospice care. Hell yeah. Hell yeah. And I just ask you, do you want some AI-generated computer program to take care of you at the end of your life? No. Do you want someone that's underpaid and tired caring for you at the end of your life? No. Or do you want someone highly trained, rested, and paid what they deserve? Get a contract now. Thank you.
Thank you, Matt. And with that, we'll see if there's any questions from the press for any of those of us who have spoken.
Is there a date on the table for the next contract negotiations?
Yes, we have 3 dates of bargaining upcoming towards the end of July. I believe the next one is July 23rd. Other questions?
A little bit more about the staffing challenges you guys are facing.
Susie?
Staffing challenge.
Right there.
Staffing challenges? Well, we don't have enough nurses, right? It's hard to take a day off. We're salaried, so they can kind of exploit us with that. Whether that's the intention or not, I'm not attaching blame to that. But what we've got is a situation where even when we're not working, we're checking to see how our patients are doing because we're not sure they're going to get taken care of. We don't know that they're going to have a visit. They might just get phone calls. Oh, we hope you're okay, right? Oftentimes we're short-staffed in the weekends and the nights and the evenings. And the nurse that's worked all day, sometimes 10, 12 hours, is then being mandated to pick up and work 8 to 10 hours in the evening. And then go back and do the next day. Maybe get a nap in. You can take a little nap. And then you got to go to work, right? Yeah. Sometimes, that's getting 4 or 5 hours maybe of sleep. And we got families. We have lives. So we need adequate staffing to be able to care for our dear patients.
Thanks, Susie. Any other questions?
Again, what was the first day of the first negotiations?
So the group organized their union in April of 2025, and I believe we started the bargaining process in around June of last year. So we're just over a year, and still have a long way to go to reach a first contract. Any other questions? All right. Well, thank you all for being here, and when we fight, we win. When we fight, we win. When we fight, we win. And when we win, we dance. We dance. Yeah. All right. Let's hit the picket line.
All right, there you go. We've been listening into a rally kind of news conference here for a one-day strike of hospice nurses outside Allina Abbott Northwestern Hospital. This is 65 nurses from SEIU Healthcare, Minnesota and Iowa. They've been bargaining, as you heard them just say, for about 1 year now, seeking a new contract. As they've stressed here, staffing remains a major issue of contention here, that they say they are often overworked. Also a demand here that saying Allina's been denying them interim raises during the past year, during this process, because of the negotiation. And they say that they don't believe that that's appropriate either, that they should be getting interim raises even during this negotiating process. So they are doing a one-day strike. Began at 7 a.m. today, continues until 5 p.m. tonight out